Have you ever experienced persistent itching in certain areas of your body and found yourself questioning its significance? If so, you're certainly not alone. In today's discussion, we're uncovering an essential topic: the connection between specific itchy spots in older adults and potential underlying health issues. Research indicates that unexplained itching can sometimes be a warning sign of serious medical conditions, including cancers and autoimmune disorders. For instance, a study published in the Journal of the American Academy of Dermatology highlighted that nearly 20% of lymphoma patients report severe itching as a significant symptom, indicating that persistent itchiness should never be overlooked. As we delve deeper into this subject, it's crucial to recognize how lifestyle choices and nutrition can profoundly impact both our skin health and overall well-being, especially for the elderly. A healthy diet rich in vitamins and hydration can significantly reduce occurrences of dry skin, which is often a common complaint among older adults. Additionally, maintaining a balanced lifestyle can help manage chronic conditions that may contribute to skin irritations. Let's consider a few scenarios beyond just one individual. For example, there's Mr. Thompson, a 65-year-old retired teacher, who began experiencing nagging itchiness on his arms. Initially, he brushed it off, attributing it to dry skin from the changing season. However, as the weeks passed, his wife noticed he had lost weight and seemed more fatigued. Concerned, they visited their doctor, who conducted tests that ultimately revealed an underlying thyroid condition. Similarly, Miss Kelly, a 70-year-old grandmother, noticed persistent itching around her waist, which she thought was merely a reaction to her laundry detergent. After discussing her symptoms with her family, they encouraged her to seek medical attention, leading to a diagnosis of eczema that required proper treatment. These examples illustrate the importance of listening to our bodies and the value of support from loved ones in recognizing when something may be wrong. If you can relate to these experiences or know someone who has faced similar symptoms, I invite you to share your story in the comments below. Your insights could help others understand that they are not alone in their struggles. While it's important to take itching seriously, it's also essential to remember that not every instance of itching signals a severe problem. Many people experience occasional itchiness due to harmless factors like dry skin or seasonal allergies. However, being informed and attentive to persistent or unusual symptoms can make a significant difference in health outcomes. Stay tuned as we explore the specific areas of the body that are most commonly associated with such itching and what they could signify about your health. You won't want to miss the crucial information ahead. Thank you for joining us today on this journey of understanding. If you find this content valuable, consider engaging with our community by sharing your thoughts or experiences. We look forward to connecting with you and providing more enlightening discussions here at Nourish Now. Have you ever found yourself experiencing persistent itching in certain areas of your body, wondering what it might signify? If the answer is yes, you are certainly not alone. Many individuals, particularly older adults, encounter this uncomfortable and often perplexing symptom at some point in their lives. Today, we're diving into an essential topic: the connection between specific itchy spots in the elderly and potential underlying health issues. Research has increasingly shown that unexplained itching can sometimes serve as a warning sign of serious medical conditions, including cancers, liver diseases, and autoimmune disorders. Studies have highlighted the importance of paying attention to persistent itching, particularly in older adults. For example, a study published in the Journal of the American Academy of Dermatology revealed that nearly 20% of lymphoma patients report severe itching as a significant. This statistic emphasizes that persistent itchiness should never be brushed aside, as it may indicate a serious underlying problem that requires medical attention. By understanding these connections, we can become more proactive about our health and well-being. As we explore this topic, it's essential to recognize how lifestyle choices and nutrition play a crucial role in influencing both our skin health and overall well-being, especially for elderly individuals. A healthy diet rich in vitamins, minerals, and hydration can significantly reduce occurrences of dry skin, which is often a common complaint among older adults. For instance, incorporating foods high in omega-3 fatty acids, such as fish and flax seeds, can help maintain skin moisture. Additionally, ensuring adequate hydration can improve skin elasticity and reduce dryness, ultimately leading to fewer instances of itching. Let's consider some real-life scenarios beyond just one individual to illustrate the importance of recognizing persistent itching. Take Ms. Thompson, for example, a 65-year-old retired teacher, who began experiencing nagging itchiness on his arms. Initially, he dismissed it, attributing it to dry skin from the changing seasons. However, as the weeks passed, his wife noticed that he had lost weight and seemed more fatigued than usual. Concerned about his well-being, they decided to visit their doctor for a checkup. After conducting a series of tests, the doctor revealed that Mr. Thompson had an underlying thyroid condition that required treatment. This case highlights the significance of not ignoring seemingly minor symptoms, as they can be indicative of more serious health issues. Similarly, let's look at Mrs. Kelly, a 70-year-old grandmother, who noticed persistent itching around her waist. She thought it was merely a reaction to her laundry detergent and didn't think much of it at first. However, after discussing her symptoms with her family during a weekend gathering, they encouraged her to seek medical attention. Following their advice, she visited her healthcare provider, who diagnosed her with eczema that required proper treatment. This example emphasizes how supportive family members can play a vital role in recognizing when something might be wrong and encouraging individuals to take action. These scenarios illustrate the importance of being attentive to our bodies and the value of support from loved ones. If you can relate to these experiences or know someone who has faced similar symptoms, I invite you to share your story in the comments below. Your insights could help others understand that they are not alone in their struggles and may encourage them to seek the help they need. While it's essential to take itching seriously, it's also crucial to remember that not every instance of itching signals a severe problem. Many people experience occasional itchiness due to harmless factors like dry skin, seasonal allergies, or even minor irritants in their environment. However, being informed and attentive to persistent or unusual symptoms can make a significant difference in health outcomes. It's about striking a balance between awareness and not allowing unnecessary anxiety to take hold. As we move forward in this discussion, we will explore the specific areas of the body that are most commonly associated with such itching, as well as what these symptoms could signify about your health. Understanding these connections is vital for anyone looking to enhance their well-being or that of their loved ones. So, stay tuned for the crucial information ahead, as it could help you or someone you care about. Thank you for joining us today on this journey of understanding. If you find this content valuable, consider engaging with our community by sharing your thoughts or experiences related to itching or other health concerns. We look forward to connecting with you and providing more enlightening discussions here at Nourish. Your participation helps us create a more informative and supportive environment for everyone. As we delve deeper into the topic of persistent itching in older adults, it's crucial to understand that this symptom can be more than just a minor inconvenience. It can serve as a significant warning sign that something may be amiss in our health. Many individuals may not recognize that persistent itching, particularly in certain areas of the body, can indicate underlying conditions that require medical evaluation. This segment aims to shed light on why it's essential to pay attention to these signals and what they may mean for our overall well-being. Research has shown that persistent itching in older adults can be associated with various health issues, ranging from benign to serious. For example, a study published in Dermatology Research and Practice found that skin conditions like eczema and psoriasis are prevalent among the elderly, often manifesting as chronic itching. However, researchers also highlighted that skin-related symptoms could sometimes be the first indicators of systemic diseases, including liver disease, kidney dysfunction, and even certain types of cancer. This underscores the importance of taking note of any changes in your body, particularly when they persist over time. One common misconception is that itching is merely a cosmetic issue, but it can significantly impact a person's quality of life. Individuals experiencing chronic itching may find it difficult to concentrate, sleep, or engage in daily activities, leading to increased stress and anxiety. For instance, Mr. Thompson, whom we mentioned earlier, expressed how the constant itchiness affected his ability to focus on his teaching duties. He found himself becoming easily distracted and irritable, which ultimately influenced his relationships with both colleagues and students. This example illustrates how a seemingly minor symptom can spiral into broader issues that affect overall mental and emotional well-being. Conversely, being aware of the potential implications of persistent itching can empower individuals to seek timely medical advice. Early detection of underlying conditions can lead to more effective treatment options and improved health outcomes. Therefore, if you or someone you know experiences ongoing itching that does not respond to over-the-counter treatments, it is essential to consult a healthcare professional. Taking that step can lead to a proper diagnosis and provide peace of mind. As we explore the specific areas of the body that are commonly linked to persistent itching, it's important to note that these regions can offer clues about what might be happening internally. For example, itching in the armpits can sometimes be associated with diabetes, as high blood sugar levels can disrupt skin health and lead to dryness and irritation. Similarly, persistent itching around the genital area may indicate infections or conditions such as vaginitis or scabies, which require attention to prevent further complications. While it's vital to be aware of these signs, it's also essential to approach them with a balanced perspective. Not every instance of itching requires immediate panic or concern. Many people occasionally experience itchiness due to harmless factors such as dry skin, allergies, or even irritants in personal care products. Understanding the context of your symptoms is crucial. For example, if the itching is seasonal or related to a new soap, it may be more benign than if it is accompanied by other symptoms like weight loss or fever. Moreover, family members and friends can play a crucial role in helping individuals recognize when to seek medical advice. Often those closest to us may notice changes in our behavior or health before we do. For instance, Mrs. Kelly's family encouraged her to see a doctor after they noticed her discomfort and changes in her mood. Their support not only prompted her to take action, but also provided her with the reassurance she needed to address her health concerns. I encourage you to reflect on your experiences or those of your loved ones. Have you ever ignored a symptom that later turned out to be significant? Sharing those stories can not only help others feel less isolated but also foster a community of awareness and support. If you've dealt with persistent itching or other health concerns, consider sharing your journey in the comments below. Your insights could be invaluable to someone else who might be going through a similar situation. In summary, it is essential to recognize that persistent itching can often serve as a warning sign of underlying health issues, especially in older adults. While not every case indicates something severe, being vigilant and proactive about health is crucial. If you notice any unusual or ongoing symptoms, don't hesitate to consult a healthcare professional. Protecting your health and well-being should always be a priority. Thank you for joining us in this important discussion. If you find these insights helpful, consider engaging further with us by sharing your thoughts and experiences. We are here to provide valuable information and support, so stay tuned for the next segment. We appreciate your participation and look forward to continuing this journey with you here at Nourish Now. Your engagement helps us create a more informed and supportive community for everyone. Let me share with you the story of Sarah Williams, a vibrant 62-year-old retired school counselor from Portland. Since last October, Sarah had been experiencing persistent itching that began as a minor irritation but gradually intensified over several months. Initially, she dismissed it as just another sign of aging or perhaps a reaction to the new fabric softener she had recently purchased. "I thought it would go away on its own," Sarah explained during a recent interview, her hands unconsciously rubbing her forearms as she spoke. "Everyone gets itchy skin sometimes, especially when the seasons change. I didn't think it was anything to worry about." As winter approached, however, the itching became increasingly unbearable. Sarah's daughter, Emily, noticed her mother's discomfort during their weekly Sunday dinner. "Mom kept scratching throughout our conversations," Emily recalled. "She tried to hide it, but I could see she was really suffering. Her skin didn't even look particularly irritated, which I found strange." Despite her daughter's growing concern, Sarah continued to treat the symptom rather than investigating its cause. She purchased various moisturizers, anti-itch creams, and even tried changing her laundry detergent and bath product. Her bathroom cabinet gradually filled with half-used bottles of lotions and ointments, none of which provided lasting relief. "I tried everything available at the pharmacy," Sarah said, gesturing toward the collection of products she had accumulated. "Some would work for a day or two, but then the itching would come back, sometimes worse than before." What Sarah found particularly alarming, though she initially kept it to herself, was her unexplained weight loss. Despite maintaining her usual appetite and eating habits, she had lost nearly 15 pounds in just 3 months. Her clothes hung loosely on her frame, and friends began commenting on her appearance, asking if she had started a new diet regimen. During a family gathering at Thanksgiving, Sarah's sister, a retired nurse, noticed both the constant scratching and Sarah's thinner appearance. "That's when the alarm bells really started ringing," Sarah admitted. "My sister pulled me aside and told me in no uncertain terms that I needed to see a doctor immediately." Following her sister's advice, Sarah finally scheduled an appointment with her primary care physician. After a thorough examination and several diagnostic tests, Sarah received news that shocked her. The persistent itching she had been enduring for months was actually a symptom of lymphoma, a type of cancer affecting the lymphatic system. When the doctor said cancer, I felt like the floor had disappeared beneath me, Sarah recalled, her eyes welling with tears. I never imagined that something as simple as itchy skin could be connected to something so serious. I kept thinking about all those months I'd wasted trying different creams instead of getting proper medical help. Sarah's case illustrates a crucial point. Seemingly minor symptoms can sometimes be indicators of serious underlying health condition. The connection between itchy skin and lymphoma, while not immediately obvious to most people, is well documented in medical literature. Lymphocytes, which are white blood cells essential for immune function, are distributed throughout the body's tissues and organs. When lymphoma develops, these cells can become cancerous and release substances like histamine into the bloodstream, which then travel throughout the body and stimulate nerve endings in the skin, resulting in that persistent, often intense itching sensation. Research indicates that approximately 1 in 5 lymphoma patients experiences some degree of skin itching as a symptom. This statistic highlights the importance of not dismissing persistent itching, particularly when it doesn't respond to standard treatments or when it's accompanied by other symptoms like unexplained weight loss, fatigue, or swollen lymph nodes. Sarah's family physician, Martinez, explained, "Many patients don't realize that skin symptoms can be manifestations of internal diseases. In Sarah's case, the itching was her body's way of signaling that something was wrong. Fortunately, we caught it at a stage where treatment options are quite effective." Today, Sarah is undergoing treatment for her lymphoma and is responding well. She's become an advocate for paying attention to persistent symptoms and seeking medical advice rather than self-treating indefinitely. "I share my story with everyone I know," "If my experience can help even one person get an earlier diagnosis, then something positive has come from this challenging time." If you've been experiencing persistent itching that doesn't respond to over-the-counter treatments, especially if it's accompanied by other symptoms like weight loss or fatigue, please consider consulting with a healthcare professional. Early detection can make a significant difference in treatment outcomes. Have you or someone you know experienced unusual symptoms that turned out to be important warning signs? Your stories and experiences could help others in our community recognize when to seek medical attention. Please share your thoughts in the comments below. Beyond the persistent itching that Sarah experienced, lymphoma can manifest through various other symptoms that are important to recognize. Understanding these warning signs can lead to earlier detection and more effective treatment out. In this section, we'll explore the comprehensive symptom profile of lymphoma and why these indicators should never be overlooked. Lymphoma, a cancer that affects the lymphatic system, can develop in many areas of the body since lymphatic tissue is widely distributed throughout our organs. Dr. Rebecca Anderson, an oncologist at Memorial Medical Center, explains, "What makes lymphoma particularly challenging to diagnose early is that its symptoms often mimic common, less serious conditions. This is why paying attention to persistent symptoms, especially when they occur together, is crucial." One of the most recognizable signs of lymphoma is the enlargement of lymph nodes. These small bean-shaped structures can become noticeably swollen, particularly in areas like the neck, armpits, or groin. Unlike the temporary swelling that might occur during an infection, lymphoma-related enlargement typically persists for weeks or months without subsiding. Mark Davis, a 68-year-old retired postal worker, initially dismissed the swelling in his neck as a lingering cold symptom. "I thought it was just part of getting older. Your body takes longer to recover from everything," he shared during a support group meeting. "It wasn't painful, so I didn't worry about it until my wife insisted I get it checked. That insistence led to an early diagnosis of Hodgkin lymphoma and successful treatment." Another common symptom is unexplained fever, particularly low-grade fevers that come and go without any apparent cause. These fevers are often accompanied by night sweats, which can be severe enough to soak through bedding in pajamas. Elizabeth Turner, a 71-year-old grandmother of 5, described her experience. "I would wake up completely drenched, even in winter. I had to keep extra sheets and nightclothes by the bed. At first, I thought it was just menopause making a comeback, but when it continued for months, my daughter convinced me to talk to my doctor." Her physician ordered tests that revealed non-Hodgkin lymphoma. Unexplained weight loss is another significant warning sign that should never be ignored, especially when it occurs rapidly without changes in diet or exercise habits. Research published in the American Journal of Hematology
indicates that approximately 30% of lymphoma patients experience unintentional weight loss prior to diagnosis. This was true for James Wilson, a 64-year-old high school basketball coach, who lost nearly 20 pounds in 2 months despite maintaining his usual appetite. "My players noticed before I did," James wrote. "One of them asked if I was on a diet, and that made me realize how much weight I'd actually lost." This observation prompted James to seek medical attention, leading to his diagnosis. Persistent fatigue that doesn't improve with rest is yet another symptom commonly associated with lymphoma. This isn't the typical tiredness that comes from a busy day. Rather, it's a profound exhaustion that interferes with daily activities. Patricia Martinez, a 70-year-old retired librarian, described it as feeling like I was walking through molasses all day long. She added, "I've always been active, but suddenly I couldn't even make it through grocery shopping without needing to sit down. My friends noticed I wasn't joining our weekly walks anymore, and their concern finally pushed me to see my doctor." Anemia, a condition characterized by a decrease in red blood cells, is also frequently observed in lymphoma patients. This can contribute to the fatigue mentioned earlier, as well as symptoms like shortness of breath, dizziness, or pale skin. Regular blood tests during physical examinations can help detect anemia early, potentially leading to further investigation if other symptoms are present. It's important to note that experiencing one or even several of these symptoms doesn't necessarily mean you have lymphoma. Many of these signs can be caused by less serious conditions. However, when these symptoms persist or occur together, they warrant medical attention. As Dr. Anderson emphasizes, the key is persistent. If symptoms don't resolve within a reasonable time frame, or if they're getting worse, that's when you should consult a healthcare professional. For those over 60, being vigilant about these symptoms is particularly important, as the risk of lymphoma increases with age. According to the American Cancer Society, the median age at diagnosis is 66 for non-Hodgkin lymphoma, which accounts for about 90% of all lymphoma cases. If you're experiencing any of these symptoms persistently, please don't hesitate to discuss them with your healthcare provider. Early detection can significantly improve treatment outcomes and quality of life. Have you noticed any of these symptoms in yourself or a loved one? Remember that sharing your experiences in the comments could help others recognize important warning signs they might otherwise dismiss. Your story might be the nudge someone else needs to seek medical attention.